We will now share a short video from one of our patients before we have Dr. Parul start the patient section voices.
I really didn't want to tell anyone I was sick. I didn't believe the doctor. I have no symptoms. I don't even have a headache. And I come to find that hepatitis C can lay dormant in your body for up to 20 years without any symptoms. I asked the doctors, well, how do you get hepatitis C? My doctor came back to me. She says, well, you say that you're in recovery during your years of use. Did you exchange needles? Well, no, I didn't exchange needles, so I knew that wasn't the case. And finally, they just wrapped it up, saying that way of life, when you have a lot of drugs you're exchanging, if you snort cocaine, exchanging dollars that's rolled up, just being in contact with a lot of people in that way. I ended up with liver cancer. Relatively speaking, the liver cancer was pretty simple to cure. But at that time, my liver had been destroyed. We have to start talking about a transplant. And so when I got the liver transplant, life came back to me. You can get well. And here today, 35 years clean, I'm living life beyond my wildest dreams. And I am loving life again.
Wow, that is a wonderful testament. And I'm so excited to have Darryl, the star of the video, here with us today, as well as Daniel Romero, who will be sharing their stories, led by Dr. Parul.
Thank you, Ivory. Please let's extend a very warm welcome to Darryl Ellis and Daniel Romero, who have been kind enough to share their story with us today. So without further ado, I'd like to first turn to Darryl. Darryl, do you want to talk to us and share your experience?
Yes, thank you very much. Thank you very much for having me today. As I've been listening earlier today, I see how very fortunate I am to be successful with liver cancer in the way that I was. You know, my story started, I knew that I had health issues 2001. I'm a veteran. Let me start with, I'm a veteran. So I go to the VA, the Veterans Administration, for health purposes. And so a routine checkup diagnosed that I had the hepatitis C virus. And as I said in the video, I didn't believe the doctors when they told me that I had hepatitis C because I wasn't sick. I didn't feel bad. I didn't even have a headache. There was nothing happening with me to make me think that I was sick. But I discovered hepatitis C can lay dormant in your body for 10 years, up to 20 years with no symptoms. However, the damage is being done. And so that was the case with me. One of the challenges of knowing that I had hepatitis C in 2001 was there was only one treatment for hepatitis C at that time. It was a treatment called interferon. Interferon wasn't very successful, and it had some devastating side effects. So I didn't want to do interferon because, again, I didn't think I was sick, and I didn't want to go through those side effects. A friend of mine convinced me to get a second diagnosis from some other health facility. And I did find out that I had hepatitis C, in fact. So once I knew that I had it, I tried interferon. Interferon wasn't successful for me, but the doctors continued to monitor me because they knew that hepatitis C could also lead to liver cancer. And sure enough, I had liver cancer. But we were able to get that under control or to cure the liver cancer basically with two treatments. It was a microwave ablation. So again, two treatments, and my liver cancer was cured. But at that time, we started to talk about the transplant because my liver had been damaged to that point. So I did get the transplant. And once I got the transplant, during my transplant surgery for the liver, my kidneys shut down. So I spent about 19 months on dialysis. And then once I got the kidney transplant, then we began to look at the cure for hepatitis C. And as opposed to 2001, when there was only one cure or one treatment for hepatitis C, in 2016, there were 4 or 5, maybe even 6 treatments for hepatitis C. And all of those treatments were running at 96 to 100% successful. And I did try one of the treatments. The treatment that I had was Harvoni. and Harvoni cured my hepatitis C. So today I have a new liver. A liver transplant saved my life. I have a new kidney. Once I got the kidney transplant, the quality of my life increased 1,000%. And with Harvoni, we were able to cure the hepatitis C virus. So here again, I'm whole again, a productive member of society, and very excited to be here. So again, I thank you for having me here today.
That's a really remarkable journey, Darryl. I want to ask you, when you first found out about the liver cancer, did you tell anyone? How did you share that news with or who did you share that news with?
I really did not share that with anyone. I really didn't tell too many people. I live with my significant other. She, of course, knew, and my very close family members, a few of my very close family members. And as I look back on that, we've been talking about that lately within some groups. One of the things, I think I had my own stigma about hepatitis C, the things that came with hepatitis C. And I think that stigma evolved around the fact, as I said in the video, I'm a recovering addict. And August was 35 years of recovery for me. So I knew that most of the things that were happening with liver cancer, with hepatitis C, it all stemmed one way or another from my drug use and my activities doing drug use. So I think it was my own stigma that I put on things, the reason I didn't talk to many people.
That's very understandable, and I'm sure a lot of people in your circumstances carry that same stigma that you did. How would you describe your relationship with your healthcare team?
My healthcare team was excellent, was very, very nice. Again, as a veteran, I go to the VA hospital. I had the advantage of having everything was a specialty. I had a special liver doctor. I had a special kidney doctor. Going through the process of qualifying to get on the list, the first thing they tell us is that you must have a support system. And I said to my doctor, I said, well, sure, I have some friends. If I need to go to the doctor, if I need to go pick up some medicine or something, she says, no, you don't understand. When I say support system, I mean somebody who's going to be there with you all the time, because there are going to be some days that you can't feed yourself. There are going to be some days that you can't dress yourself. So you need that. And so I had that with me all the time, but that was with me there. And so again, my healthcare team was just very informative, and I felt like I felt like they really cared about me, and not necessarily just we're treating this disease, we're treating this virus. I really felt like they cared about me.
That's wonderful. Did you find that there were other things that helped you during your treatment? During your treatment and the process that you went through, because it was a very long journey for you.
It was a long journey, yes, and I had to depend on my healthcare team, because when I first started the journey of finding out I was sick, I lived in South Florida. I worked for the cruise lines, and then I left the cruise lines, and while I was still living in South Florida, I found out that I was sick. I'm originally from North Carolina, so I kind of moved back to North Carolina, or I started to gravitate back to North Carolina just so that I could be with family and be around family. So I didn't really know a whole lot of people. So my healthcare team they were my friends. They were my people that I confided in. They were people that I spent time with. So they were my circle of friends.
Well, that's really good. I'm really glad that you had that support that you needed, because it takes a lot of fortitude to go through something like that. And it's good that you had that.
It really is. I mean, they really imply to you, or they really put into your head, you can't do this by yourself. And you can't. It's just, there are too many factors. There are too many things. Number one, I had no idea what I was walking into. I had no idea what they were talking about in many cases. So I had to believe my doctors. I had to believe my healthcare team. I had to trust my healthcare team. And one of the things that really stands out of my mind now that set me apart, I had an appointment with my liver doctor, and my appointment was running like 20 minutes late, maybe 30 minutes late. And I'm hot. I'm like, man, be on time for your appointment. And as I walked into the door, she could tell I was upset. And she stopped everything and said to me, when you get to me and your treatment, it's pretty serious. And there are going to be some days you're going to need more time. And I'm going to give you all the time that you need. And I'm going to do that same thing for you, Darryl. If you come in and you need some more time, I'm going to give you all the time that you need. And that, it just, well, number one, it just disrupted my being upset. And I understood that. And that kind of put me at ease. And that was the flavor of everything as I went through the treatment.
Well, that's wonderful. Well, thank you so much for sharing your journey with us. You look fantastic. I'm glad that you've had the quality of life that you do and that you're enjoying, something 1,000% better. It's wonderful to see. And it's been a long road, but hard earned. And so I'm so happy for you. I would like to turn our attention now to Daniel Romero. And Daniel, if you can share your story with us.
Yes, good morning. Thank you for having me this morning. I'm so excited to be here. When I was asked to participate, I was elated, but I was also a little scared about what they were going to ask me and about my journey. But my journey's been very how do I say this? It was kind of difficult for me because finding out that I had liver cancer was challenging in itself. For whatever reason, it just felt like liver cancer ran in my family. My great-grandmother, my mother's grandmother, died from liver cancer at the age of 60 back in 1939. And then my mother died from liver cancer in 2013. I was diagnosed with liver cancer in 2018, but I knew that I had elevated liver enzymes from the time about 2013. And my doctors told me that, I had fatty liver and that I needed to take better care of my diet. I was type 2 diabetic and I had to do all these things that they were asking me to do. But I was sort of consumed with what was going on with my mother at the time because they had discovered that she had the fatty liver and that she was developing tumors in her liver. Unfortunately, they couldn't do anything for my mother because she was already advanced in her age as well. And so she did not get a liver transplant and as a result died in 2013. And after that, I started thinking maybe I should start taking better care of myself. And I really didn't. And as a result, I ended up with the liver cancer. And when I was told that I had liver cancer, it was a little shocking because I knew that I had fatty liver disease, but I had no idea what to expect when I found out that I had liver cancer. I was very fortunate in that I have a very strong family support system, from my wife to my daughter to my son, my family members. And so that was an easy part for me. What was hard part was not understanding what to expect next. And so when my gastroenterologist told me that he needed to refer me to a specialist to handle my liver cancer, I was then sent to a hepatologist, a specialist, who I worked with, and a team of specialists at the hospital. And it was there that I learned so much about liver cancer and liver disease. And the team that I have at the hospital was just phenomenal. I was so elated to see the way they communicate with you and how they make you at ease. And of course, they worry about your support system. They worry about your financial situation. They worry about your health and everything that's going on around you. And it just made me feel at ease. What I was most concerned about, and my wife, was what do we expect? What should we know about this disease? What should we know about what's going to happen to me? It really threw us for a loop because we didn't know. My wife just thought liver cancer, was the sign of death. And it really wasn't that. It was more a sign of hope. Once we started talking to the doctors and what was going on with me, I went through a series of treatments and, lung treatments to make sure I was viable for a transplant. I went through embolization. I mean, it was a very long journey from the time that I, started my diagnosis in 2013 to cancer in 2018 to my transplant in 2020. Here we are 3 years later, and I'm so happy. I mean, I'm so grateful for the life that I'm living today. It's afforded me the opportunity to do things that I want to do, but it's almost uh, for me a way of giving back. Uh, I was a caregiver. It still am a caregiver. I took care of my during the time that I was very sick. After my mother passed, my father came to live with us, and he lived with us until he passed. I was very, very sick with liver disease and liver cancer. My dad died a month before his 90th birthday, and uh, about a month and a half after he passed, I had my liver transplant. So it was almost like everything kind of fell in place, and I was able to get my transplant. My family was there, all of my siblings were there. And it was just, for me, it's been a miracle. My wife calls me her miracle. I'm so happy to be alive and so happy that I'm here today.
Thank you for sharing that journey with us, Daniel. That sounds like you have a great family support. So has been a real backbone for going through all this.
Yes.
Was your family there was your wife there when you first heard about your cancer diagnosis, or who did you tell first?
It was my wife. My wife and I, well, I was at the doctor, and when he told me, I was at the doctor by myself, and then I had to tell him I had to go home and share it with my wife and tell her. And of course, it was at that moment that she kind of realized cancer, is almost the sign of death. And I told her, says, I don't think so. I said, the doctor made it sound very hopeful. I said, so there's an opportunity for me to, live a better life. And so it was immediately at that point when we started, she said, well, we need to get a hold of that specialist. We need to get you taken care of and all of that. But she was my very first support in that. And then we shared it with our children and, and my family, my wife's sister and her husband. She's the only sibling my wife's got, and my siblings. And it was amazing how everybody just rallied around my wife and I. What can we do? How can we help you? What do you need? And that really lent credibility to how I felt about family and what family means when you're going through something of this nature.
Yeah, absolutely. How would you describe your relationship with your healthcare team?
The best. From my surgeon to my hepatologist to the coordinators and the nurses, they just they're so empathetic and sympathetic to what you're going through. And just as Darryl said earlier, they embrace you, and they become your circle of friends, and everything that you're going through, they're there for you. They talk to you. They the warmth that you feel. I mean, spending the time in the hospital after transplant, they're just so attentive, and that makes the world of difference to a patient, because you're there and you're scared and you don't know what's going to happen. And every step of the way, they're telling you what to expect. What do you feel? How do you feel? What can we do for you? And also I'm type 2 diabetic. So I was they were making sure that my sugar levels were level and that I was feeling okay and that I didn't drop, my sugar levels didn't drop too low or they didn't go too high. And, it was so, everybody, even my interventional radiologist, and he helped me through the cancer itself and going through the embolization process. It was just, I can't thank the hospital staff enough for everything that they've done for me. Even today, if I struggle or I have anything, I just pick up the phone and I call my transplant team, and someone always answers the call, or they call me back and answer my questions.
I'm really glad that you had such a positive experience in the face of negative news. It's good to hear that. And this question I'll give to you, but after you're done, Darryl, you can please chime in as well, because we would love to get your input on that. This is tough information for a patient to be dealing with, for anyone. What would you tell other patients who are currently going through this process? Any things, what things did you lean on? What helped you through this process?
Well, first and foremost, I think attitude is the most important. Your attitude must be survival and positive. That this is just, in my humble opinion, it's just a bump in the road. You have to look at it and say, this too, I will overcome. And when your attitude is such that you feel that way, it just seems like the ball rolls in that direction. And when I received the news, well, my wife felt like it was devastating. I never felt that way. I always felt like there's hope. And that hope led to me looking at my whole life as something that I'm given this opportunity. Now, what are you going to do with it? Take it, run with it, be as positive as you can. And as a patient, don't be afraid. Don't fear anything that you're going through. Ask questions. If you don't understand something, if they're talking medical terminology and you don't understand it, ask them, what does that mean? I don't understand what you're saying there. Help them to ease your mind so that you can feel comfortable when you're relating to them about what it is that you're going through. Whether it's, I have a stomach pain and I don't understand what that means. They can walk you through that process. And everything that you're feeling, take it with a grain of salt and know that they're working toward your best interest. So as a patient, be positive, walk in positivity, and do the best that you can, because there is going to be something greater ahead of you.
That's wonderful. Words to live by.
Yes.
Anything to add to that, Darryl?
No, Daniel said it all. That's the thing. It's a positive attitude. My motto during the time I was going through it: keep your spirits high and keep your faith strong, and
Yes.
It's going to be all right. It's going to be all right. I can't say it any better than Daniel.
Well, the two of you have given us a very enlightening look at, a very personal look at the journey of liver cancer diagnosis and treatment. I'm so happy that you're both experienced such a positive outcome and are enjoying your life. And I wish you all the best in the future.
Thank you. Thank you so much.
Thank you so much.
Thank you.
Oh my gosh. Thank you so much, Darryl and Daniel and Dr. Parul, for that segment. We had some really great comments in the section. Thank you for great information, presentations. This was all very encouraging to those of us coping with this disease. Bravo to the healthcare teams in this field. Thank you for sharing your stories. Your stories matter and give others hope who are at a different point in their journeys with Hep C. And Darryl and Daniel, I 100% loved your stories and well said. So thank you guys so much for that.